for me, I think this is the plasma tests are going to be a game changer for Alzheimer's, because the spinal fluid and amyloid PET are great. They're big advances for our field. Being able to detect pathology with those tests, they're expensive and they're not widely available. A lot of people don't want to have a spinal tap. Some people can't have a spinal tap for various reasons. So it's just not that practical. And I think blood tests are going to be, terrific. I think initially they'll probably be used to help to screen. So let's say for drugs like aducanumab or any ones that will follow, that we could probably reduce the number of PET scans or spinal taps we get based on the plasma tests. There are two types of tests. Some tests for amyloid, an A beta 40 to 42 ratio, and some tests for tau, another important protein, though probably the leading one right now is phospho-tau 217. And both of those give pretty good information about amyloid buildup in the brain, and also about, at least the phospho-tau test, about tau buildup in the brain as well. So we're really excited about it. I know Lilly showed some data that their antibody donanemab actually reduced p-tau 217 substantially. So when amyloid went down in the brain, the plasma marker of phospho-tau also went down. So that's encouraging that we can sort of monitor progress with a blood test in the future. So it's still early days, that it's not validated yet for clinical use, but I don't think we're very far away. And I think, at least from my understanding, what I'm hearing so far is that we should be able to, for the majority of patients, get a clear readout, either they're elevated or not. And that would be really helpful, because then the people that are not elevated probably don't need any additional testing, probably don't have Alzheimer's. People that are clearly elevated probably do have Alzheimer's. We can confirm it with an additional test, at least right now. And that's going to be really helpful. And then there may be some people in the middle where we're unsure, and that we have to sort of sort out how to, refine the test so that we can get a clearer readout for the intermediate group.